Health Workers Union, Haitu, has strongly criticized the Gauteng Department of Health for plans to cancel overtime for doctors. The union calls on the department to reconsider its decision, as this has the potential harm on the healthcare system. For more on this conversation, we are now joined by Health and Allied Workers Indaba Trade Union President Rich Sicina. Rich, thank you so much for your time and for joining us this evening. Can you explain the department's plans to cancel overtime? What are the specific reasons or justifications provided by them for this decision?
Thank you very much for having us and for inviting us on this platform, Katleho. Good evening to your team there in studio and the viewers at home. Salute. You know what? The only reason, even though it's not specifically put out there, but they are simply saying they don't have money. They are they are again crying poverty. As a result, they wanted to save that money that actually was supposed to be given to doctors for that particular overtime, because it's a readily available money. Remember, when doctors come into the system, they sign a contract that you are going to have a committed overtime. Whether you work for overtime or you are not going to work it, but it's included in your salary. So as a result, a CEO, clinical managers in our facilities have to make sure that they allocate doctors. Obviously, even that, it is a dysfunctional way of trying to solve the gross shortage of doctors problem in the country by actually forcing or imposing this particular overtime on doctors. But nonetheless, it was helping the system, because in the absence of the best, mediocre becomes the best. Now just imagine in a situation where we have gross shortage of doctors, and now that this particular overtime has to be stopped by those in positions of authority under the leadership of ANC, of which we believe, where we are sitting as Health and Allied Workers in the Trade Union, is that they are wanting to use that money to campaign. Why all of a sudden now, when we are actually closer to the national elections, why that particular money has to be stopped? Why are they sacrificing our healthcare system again, crying poverty? Of which, on top of that, there's this issue of austerity measures. There's no any other tangible and solid reason that says why are they stopping it. It's only for them to stop it so that they can take that money and use it somewhere, because it's there.
So, Rich, maybe just to clearly understand you here, they're stopping the doctors' overtime, but they're not bringing in another influx of doctors that would make up for the time that they're stopping the current doctors in working overtime.
That is why, Katleha, I am saying, in the absence of the best, mediocre becomes the best. Already our public health system is in tatters. If we can actually give an opportunity to, I'm from work now as we speak. What we see in our line of duty, it's a complete disaster. It makes sense why some of us, or majority of us, have medical aid, because we don't want to find ourselves being subjected to for the lack of a better word, the nonsense that we always see, mediocre and substandard that we always see, as a result of gross shortage of staff and gross shortage of material resources. There's gross shortage of nurses. Already that alone is the department is actually now, it's worse now. The department is actually using us, nurses and doctors, as accomplices of murder, because they want to stop this without providing an alternative. That's how useless our people in positions of authority can be. They are stopping. It was going to be better, Katleho, if they were saying, we are stopping this particular commuted overtime so that we can employ the 700 plus doctors who are employed. All of us were going to be happy to say, at least they are going to stop this particular overtime. In the absence of this overtime, at least we are going to have doctors who are going to be employed. At least we are not going to have a shortage of doctors. We are not going to see the disaster we see where one doctor has to be called by 5 different wards. You wait for 2 hours waiting for a doctor to come and resuscitate a patient. As nurses, we end up resuscitating a patient alone until we declare a patient ourselves dead, because there's no doctor. Not that doctors are lazy, not that maybe they are in somewhere in a shopping center, because the doctor you are calling is resuscitating another patient in casualty. It has been called in another ward. And you ask yourself, if one doctor can look after 5 wards, why can't we have 5 doctors on that day? Or even if we can't have 5 doctors on that particular day, then at least 3 doctors that are experienced, so that when we call them, we don't struggle. We end up calling interns. Obviously, intern doctors, they are also learning the ropes of this profession. So the Department of Health, those in positions of authority in Gauteng, are actually killing the community using nurses and doctors. They are using all of us as accomplices of murder. Of course.
You're painting a very grim picture here, Rich, which is very worrying. I mean, even in your statement, you described this decision and likening it to the Marikana mine massacre. What impact do you believe this decision could have on the healthcare system and the workers and patients included?
Already now, our patients are dying now as we speak because of gross shortage of staff. And it's more often than not, you know, the frustration that happens when you are overworked. Remember, we have gross shortage of staff and gross shortage of material resources with overpopulation. That the increased disease burden and the fact that South Africa, Gauteng is worse. Gauteng is a continent on its own. There is a lot of people in that particular province. So the repercussions of this is that people are going to die more. People are going to complicate more. We are actually going to have more litigation. I'm sure lawyers, wherever they are smiling wherever they are saying, yes, now that department is where we want it. And then we really can't understand. Maybe the same people in positions of power in Gauteng Department of Health are working maybe with lawyers so that to say we are going to put that department in a position where there's no way those who are working on the ground, nurses and doctors, will prevent litigations or mishaps or complications. So you have an opportunity to go and sue the state, and we can't defend ourselves as well. So there's going to be a lot of there's someone who's going to have a secondary injury. Let's say you have burns, for example, and then you go to the hospital. All we need is to make sure that we prevent infection, we prevent hypovolemic shock. But because there's shortage of doctors, we are going to go straight into hypovolemic shock. We are going to have kidney failure. But you didn't come with kidney failure. We find ourselves having all these unnecessary complications, and the ultimate result is death. We need to put it out clear.
No, you certainly have put it out very clearly, Rich. Has there been any consultations between yourselves and the department? Are they giving you any reasons as to why these decisions are being taken now, as you alluded to earlier on?
Our people and those in positions of power, politically and otherwise, are bullies. They are full of themselves. We were surprised. What we actually started by doing is to contact a few CEOs, Comrade Gauteng, to say, was there any consultation? Because CEOs of these facilities are frustrated as well. And the CEOs of these facilities are in a better position to allocate these particular doctors for that particular overtime to close those gaps. That department was supposed to call CEOs first. That's where they were supposed to start. To call CEOs and say, we are finding ourselves in this quagmire, or in between the hard place and the rock. There's shortage of money and stuff like that. What else can you do? What is it? We are thinking of withdrawing or stopping the commuted overtime. What impact will that have? I'm sure CEOs were going to say, no, don't go to that route. And there are few CEOs, about 4 CEOs that we actually spoke to. They are saying we were actually not commuted. We are actually not, no one called us to say, let's talk about this. As well as you saw that particular media statement by Gauteng Department of Health, something that was signed by the SOD. We saw it in the media space, like you did as well. Again, that's a sign of disrespect, a sign of I don't care attitude, a sign that these people, don't care about making sure that our public health care system run like a well-oiled machine. Obviously, because they are not the beneficiaries of it. When they are sick, they are going to a well-resourced private sector. It's so sad. But we must be clear to say we are watching them. We've been watching them. We are now tired. It's tiring. And our people, we are not even complaining about them giving us better salaries, Katle. All we are saying is give us resources, which is human and material resources. What we see in our line of duty, no, it's not on at all.
Rich, just lastly and very quickly, as an organization, as a union, what are your next steps? What would you like to see happen in the next week or so?
Because it's clear, it has been made clear, Katlego, that we are in a crisis in this country. We are in a crisis. We have poverty of leadership in this country. We have doctors, not only doctors, nurses, not only nurses, allied workers. That needs to be employed into the system. But for now, let's prioritize these doctors and nurses in particular to say they must be employed. What we want is for Gauteng Department of Health to stop what they want to do. They must withdraw this nonsensical statement that they actually have put out there. They must stop this, whatever they are trying to do, they must stop it. That committed overtime must continue. But the ultimate goal is to say, doctors, all those who are unemployed, nurses, all those who are unemployed, and those who are employed particularly, let's stop complaining in our corridors and in our tea rooms. It's high time now we need to come together and actually put a spotlight to those in positions of authority. Ours is to say, if Gauteng Department of Health is failing to stop whatever they want to do, let's then put it on the street. Maybe they will listen well to us when we are making noise on the street, marching and having placards and stuff like that.
All right, Rich, thank you so much for your time.